Jamaica is slated to receive the first tranche of COVID-19 vaccines in 2 weeks. Minister of Health and Wellness, Dr. Christopher Tufton, says preparations to begin vaccinating Jamaicans is in high gear. He gave an update in Parliament on Tuesday. We get more from Simone Absalom Gale.
Health Minister Dr. Christopher Tufton says Jamaica is set to receive its first doses of the Oxford AstraZeneca vaccine through the World Health Organization's COVID-19 Vaccine Global Access Facility, known as the COVAX facility.
The country is set to receive between 146,400 and possibly up to 249,600 doses of the AstraZeneca vaccine by the middle of February 2021. That's this month. This means that some 125,000 Jamaicans, or up to 125,000 Jamaicans, could receive vaccines during the months or the latter part of February into March.
Dr. Tufton says Jamaica could receive an additional 250,000 doses under another facility.
If additional supplies under the COVAX arrangements are received, and you will recall that I did update the Honourable House as to the commitment for 16% during the course of 2021, approximately 450,000 Jamaicans by the end of the year under this arrangement would receive vaccination. I must hasten, however, to caution that it is likely that the allocation could be adjusted. It could be adjusted upwards or downwards, depending on the present global circumstances and any anticipated challenges that this facility may encounter, which most likely would be issues around manufacturing.
Plans are also in place to procure vaccines from India.
The Ministry of Foreign Affairs and Foreign Trade has initiated dialogue with the UK government. I also met with the High Commissioner to Jamaica. Even as we talk with Mexico under our bilateral arrangements, with an option to approaching our negotiation through the intergovernmental machinery, the community of Latin American and Caribbean states. Madam Speaker, our objective in doing all of this, whether COVAX or the additional possibilities, is to explore all the options, to expand the pool of vaccines being made available to Jamaica so that as many Jamaicans as possible can be vaccinated. And this will help to slow the spread of the disease, of course, and reduce the severity of illness for our vulnerable population and the population at large.
The aim is to vaccinate at least 16% of the population, with a focus on frontline workers and vulnerable groups. However, in addition to an effective distribution plan, Dr. Tufton explains that public education is also key.
We will also intensify our health promotion and communication machinery, beginning with a town hall meeting on Thursday, February 4th. This is this Thursday, to further foster trust of the vaccine, dispel myths and misinformation, provide factual and accurate information about vaccination, and hopefully through this process, gain public input in the vaccination strategies to be deployed.
On the matter of distribution, Dr. Tufton says he'll be meeting with private practitioners from across the island to discuss their role in the distribution of the vaccines. The Health Minister will also be speaking with the National Vaccine Commission to finalize plans to introduce the first set of the COVID-19 vaccines.
We will also intensify our health promotion and communication machinery, beginning with a town hall meeting on Thursday, February 4th. This is this Thursday, to further foster trust of the vaccine, dispel myths and misinformation, provide factual and accurate information about vaccination, and hopefully through this process, gain public input in the vaccination strategies to be deployed.
For the news on PBCJ, I'm Simone Absalom Gale.